diuretics. Myself, Dr. Padmanabh TS. Welcome back to College. So let us see what are the different diuretics which are available and what are the important uses and what are the adverse effects, etc. So please remember, diuretics are the agent which will going to increase the excretion of water and electrolytes through the urine. So this is the basic definition of diuretics. So these are the agents which will going to increase the excretion of water and the electrolytes. So how this can be done? So there are some target sites. So let us draw a nephron. Okay, this is the nephron. This is the nephron. As you can see here, there are some target sites. So this is the proximal convoluted tubule. This is the loop of Henle. This is the early part of the distal tubule, and this is the distal tubule and the collecting duct. So there are some 4 to 5 sites where you can target the drug so that you can increase the diuretic process. So there are targets at the proximal convoluted tubule. So at the proximal convoluted tubule, the drugs which are acting are the carbonic anhydrase inhibitors, as well as the mannitol. And next we have a target sites in the thick ascending loop of Henle. Thick ascending loop of Henle. Here the drug which is targeting here is the loop diuretics. And next we have a drug which is targeting the early part of the distal tubule, that is your thiazides. Next we have a drug which is mainly acting on the distal tubule as well as the collecting duct, that is your sodium epithelial channel blockers or the antagonist, and the aldosterone antagonist. So what are all the examples we should know from each of these broad things? So under carbonic anhydrase inhibitor, they basically inhibit the carbonic anhydrase enzyme. The example is acetazolamide, brinzolamide, dorzolamide, etc. From the loop diuretics, you have furosemide, which mainly acts on the sodium potassium 2-chloride channels. And here under thiazides we have hydrochlorothiazide, which mainly acts on the sodium potassium channels. So hydrochlorothiazide acts on which channels? They acts on sodium chloride import channels in the early part of the distal convoluted tubule. And here on the distal tubule and the collecting duct, we have a drugs which are acting on the sodium epithelial channels, that is the amyloride, triamtrin, and here the aldosterone antagonist will be your spironolactone and your eplerenone. So these are the target sites you should remember.